So Dr. Amal Gatne sir, he is former professor and university head. The moment I say university head, it's MAFSU, Maharashtra Animal Fishery Science University. He is a veterinary parasitologist from Bombay Veterinary College, Mumbai. So long we talk about the professional journey of Dr. Gatne sir. He is eminent academician, researcher, and extension worker known for his skill nationally and internationally for last 34 years. If we talk about his international recognition, so international collaboration projects, 3 projects with Australia and Germany. He had worked on the panel of PhD students of University of Queensland, Australia. He is member of Asia Pacific Forum on Canine Vector-Borne Disease for last 6 years. He is the founder member of Tropical Council for Companion Animals Parasitologist. His professional contribution, he was treated as an expert in the veterinary parasitology for recruitment of academic staff by number of universities, invited as a paper setter and interview panelist by ASRB, New Delhi. He is also a small animal practitioner for the last more than 30 years. EC member for the Federation of Small Animal Practitioner Association of India. He is Vice President of Indian Society for Advancement of Veterinary Parasitology. He is the member of editorial board of Journal of Veterinary Parasitology. He had worked as editor of PPAM, that is Pet Practitioners Association in Mumbai Bulletin for 3 years. He had worked as assistant editor of Journal of Bombay Veterinary College Alumni Association for last 3 years, for more than 3 years. So this is a very short, very short summary, very brief introduction. Many more things are there which the knowledge will speak. The queries, whatever you will be presenting, whatever you will have, the reply given by Gatne sir will represent his skill more. So today we are privileged to have such a multi-dynamic and versatile talent personality with us to interact with us and enrich our knowledge and guiding us. So this is about Dr. Gatne sir. Welcome, Dr. Gatne sir. So I would like to hand over the session to Dr. Gatne sir. Dr. Samir, please help.
Okay. Yes. Sure, sir. Presentation. So, good afternoon, everyone. At the outset, I would like to congratulate Alembic Animal Health Division for holding this webinar. In fact, there are 3 webinars, one after the other, and taking its due part in the continuing education program, which is the need of an hour, because I am pretty sure that the pet practitioners all over India, they are pretty busy with their hectic schedule, and they don't find much time, to go through the literature or the books to refresh their knowledge. So such webinars or such sessions are very, very helpful to refresh the knowledge, to know about the recent updates, and also to know about some of the forgotten points. So thank you very much, Alembic, for taking initiative in this. Thank you, Dr. Amit Singh, for a very flattering introduction. And I'm really happy to be here with you all.
Yeah. duplicate.
Yeah, I think this is better now.
Done, sir. Thank you,
Okay.
sir.
Yeah. So thank you very much, Alembic, for having me invited here for delivering this webinar and also allowing me to take a part of in this continuing education program. And also giving me opportunity to share whatever little is known to me on this particular topic. Now, the topic which is assigned to me is clinical epidemiology of canine vector-borne diseases, which is popularly abbreviated as CVBDs, and I'll be talking about Indian scenario. Now, this topic is very important, not because I'm delivering this particular topic today, but you will also appreciate that you are confronted with these cases more frequently than before, and these cases are not what should I say, very straightforward cases. Most of the cases are complicated cases, very difficult to handle, very tricky situation you are confronted with, and sometimes even it leads to frustration because there are a number of relapses. The diagnosis is a problem, treatment is also a problem sometimes. So a very tricky situation, and that is why it is very necessary for the pet practitioners to have adequate knowledge about these canine vector-borne diseases. Now, when I talk about the knowledge, let me confess upfront here that there are, see, I am not going to give you some magic stick with the help of which you are going to solve all your problems. No, it is not going to happen that way because uh, there are so many knowledge gaps or research gaps existing in the literature itself. Some of the questions are unanswered. Okay, so maybe when there are knowledge gaps, at least there should not be a communication gap. So that is the whole purpose of having this particular webinar today, so that whatever information that is available, which is helpful to the field veterinarians or the pet practitioners, should be communicated to them so that they are in a better position to handle these cases. Now, as I've said in the beginning, that these cases are frequented now, or they are reported more frequently, and the main reason is that the pet population in India is increasing like anything. Okay, the pet adaptation rate is to the tune of 1,500 to 2,000 pets are being adopted every day. So, the pet population is growing. Earlier, the scenario was these animals were present only or adapted only in metros or in urban areas. But now you will see that the pets are being adopted even in rural areas, tier two cities or small towns in rural areas also. And that is how the population is increasing. Being a tropical country, these pets are infested with different types of pests. The important ones are like ticks and fleas, and they are common enemies as far as the health concerns are there. And these ticks, particularly the ticks, they have withstood all the challenges put forth by the scientific community. They have also, withstood the challenges, biological challenges, ecological challenges, and they are still occurring on these animals. And now with the more vengeance, in the sense that they have developed or adapted the ability to survive in spite of all odd situation, and not only survive but to reproduce, not only reproduce but also they have increased their vector potential during this particular phase of time. Because as you know that some of the diseases are new to India, but the vectors are same vectors like Rhipicephalus sanguinus. We will be talking on that in the next hour or so. So when they are present in large numbers, obviously they are involved in the transmission of number of diseases, which we call it as canine vector-borne diseases. And as I've said in the introduction, that these are very, very complicated cases, very, very tricky and difficult to handle. Now, because of this, two organizations have been formed. The first one was World Forum for Canine Vector-Borne Diseases, which was formed somewhere in 2006 or 7 with the headquarter in Germany, and to which number of regional chapters have been affiliated to. And I was the member, India representative of Asia Pacific Forum of Canine Vector-Borne Diseases for almost 6 years, 2009 to 2013 or 14. And then there is one more organization called TROCAP, where I was a founder member of this particular organization, which is the full form is Tropical Council for Companion Animal Parasites. So the headquarter is in Australia. Now, the basic purpose or the motto of these two organizations is to keep the pace with the research that is being carried out all over the world, particularly in tropical countries, as far as our country is concerned, or in a tropical region. And whatever, the information that is available, that is applicable, in the field conditions, for the benefit of the pets and the pets owners, that is being, transferred to the end users in the form of a guidelines or some recommendations. So these are the two important organizations. They are working tirelessly in the field of canine vector-borne diseases. Now, between the two, TROCAP is more close to us because it is pertaining to the tropical climate. So we are a tropical country, India, and also the spectrum is wider in TROCAP. In CVBD, it is only vector-borne diseases, but in TROCAP, it is all companion animal parasites. And the guidelines are also, given in a very lucid manner. As you can see here on the right side corner, I have given you the website or how it looks. You can select the guidelines and you can go ahead. If you are stuck on any information, if you want any additional information, you can refer these two sites. Okay. In fact, I have no what should I say? I can say here that 60 to 70% of my compilation is coming from the publications of these two organizations. 20 to 25% of the compilation is coming from my direct exposure to the different research schemes which were carried out at Bombay Veterinary College, and I was involved in there. And say 5 to 10% is coming from my personal experience in the form of a clinician. So let us begin with this. If you have got any queries, at the end, I will take all the queries. I don't claim to have a complete knowledge about canine vector-borne diseases, but I will try my best to answer all your queries, if not immediately, after referring to literature. Okay, so let's go ahead. As you all know that these are the vector-borne diseases, and there are three different categories of the vectors. One is a flea-borne infection, then fly-borne infection, and tick-borne infection. We can ignore for the time being flea-borne infections because there is hardly one or two filariid worms that are being transmitted, and not all over India, but southern parts of India. And those infections are also not very pathogenic. So we can ignore for the time being. In fly-borne infections, you have trypanosomosis, Trypanosoma ivansi, as you all know, leishmanosis, diarrhoefilariasis, where the heartworm is there, brugiosis, and there is one more filariid parasite called as Acanthochilonema dracunculoides. In tick-borne diseases, now this is the major area of concern. You have hepatozoonosis, you have ehrlichiosis, anaplasmosis, babesiosis, mycoplasmosis, and recently it has been updated that one filariid infection is also transmitted by the ticks. Okay, so we are not going to talk about flea-borne infections because it is not very important, and the infection is also not very pathogenic. So we'll be talking in nutshell about fly-borne infection and then more about the tick-borne infections. So in the fly-borne infections, you have trypanosomosis, which is caused by Trypanosoma ivansi. Now, Trypanosoma ivansi causes a disease in number of different species of animals, including dogs and cats. So that is there. Of course, I'll be dealing with this Trypanosoma ivansi along with other tick-borne diseases. Okay, so that is a major part of discussion in this webinar. Leishmanosis is a disease which is restricted to northwest region, particularly in Rajasthan and adjoining area. There is only cutaneous form of leishmanosis occurring in India caused by Leishmania tropica. And I have seen one case, it was referred to me about 6-7 years back from Kota region. And now these cases are also on decline. It is leishmanosis, as you all know, transmitted by sandflies. But looking to its restricted distribution and the occurrence has also gone down. Let us not, waste time in discussing Leishmania tropica. Then Dirophilariosis is a Dirophilaria emitis, as you all know, is a heartworm, and Dirophilaria repens is one more, you can call it as a sibling of Dirophilaria emitis, and it occurs in the subcutaneous tissues and which is widely prevalent in India. Brugia malaya and Brugia pahangai are basically reported from the southern parts of India in Kerala and adjoining area. So as far as Dirophilariosis is concerned, where quite a few cases have been reported from different parts of India. Now, these Dirophilaria cases are detected accidentally when the blood is examined. Actually, the blood is collected for some other reason with the anticipation of some other disease condition, and accidentally these microfilaria are detected. Now, differentiation of Dirophilaria emitis, Dirophilaria repens, and other microfilaria can be done, but you need an experienced eye for that or an experienced technician for that. Otherwise, PCR and other techniques are also available. Then mosquitoes are involved in the transmission of Dirophilaria emitis as well as Dirophilaria repens. Now, if you look at the reports of Dirophilariosis in different parts of India, you will find that heartworm infection is primarily reported from northern parts of India, and to be more precise, from the northeast region. Even from wild felids and canids have been found to be infected with Dirophilaria emitis, which is the heartworm. And if you look at Dirophilaria repens, which is resided in the subcutaneous tissues of dogs, and that has been reported primarily from the coastal areas of India, which has got a big coastal area, India. So different districts, coastal districts of India, and it has also been reported from other parts of India. So much so that I can say that Dirophilaria repens is ubiquitously distributed, uniformly distributed all over India. Now, if you look at the disease entity as such, Dirophilaria emitis can cause a serious disease. Okay, it can cause, if the worms are in large numbers present in the heart or in the pulmonary vessels, then they can cause a circulatory and respiratory distress. But to be very honest with you all, I haven't come across a single reference of a clinical case of Dirophilaria emitis. During the SNAP4, SNAP4 plus test, occasionally the antigen reaction is positive. But I haven't come across a report, a scientific report or a published report suggesting a clinical case of Dirophilaria emitis. But it can cause a disease in dogs, and it may be a life-threatening disease if large number of worms are present at a time. As far as the Dirophilaria repens is concerned, which is quite common in India, and it is harmless, practically harmless. It can cause little nodules which may appear on the surface of the skin, about 1 to 2 centimeters in diameter, and inside the nodule, the coiled worms are present. Some of the surgeons, they will endorse my views here that while doing castrations, sometimes the worms pop outside the incision. So Dirophilaria repens, that way non-pathogenic, microfilaria circulate in the blood. But this Dirophilaria repens, when it jumps on to human beings, because mosquitoes transmit. So through mosquitoes, they jump on human beings. And in human beings also, if the nodules are created in the subcutaneous tissues, it is practically harmless. But sometimes they settle in the eyeball, and they are responsible for ocular dirophilariosis. I have myself seen 2 or 3 cases in Mumbai where the entire eyeball was swollen, and then the case was referred to ophthalmologist, ophthalmic surgeon, operated, and the wounds were recovered. We identified those wounds in the laboratory as Dirophilia repens. Okay, so it has got a zoonotic importance. Dirophilia repens much higher than Dirophilia immitis. If you go through the literature, in Indian literature, there is only one reference of Dirophilia immitis or heartworm infection in human being, and that was again way back in 1970 or 80 from Mumbai region. But again, I have my own reservations about this because it was identified during histopathological examination. So in those days, identification, and that too in a histopathological examination, I have my own reservation. That is the only or a solitary reference available in the literature about human infection of Dirophilia immitis. Dirophilia immitis is also a well-known zoonosis, but as far as India is concerned, it is basically Dirophilia repens that is bothering us. Then coming to tick-borne infections, of course, along with tick-borne, as I've said, I will also be talking on Trypanosoma evans. These cases in canines and in felines are on the rise, so I'll be talking on that also. So if you look at the tick-borne infections, you have hepatozoonosis caused by Hepatozoon canis. Now, in this particular table, I have given the name of the species that is occurring in India and responsible for causing disease, and also name of the species occurring elsewhere. Now, this is very important because now you guys retrieve information from the internet or from the Google. So a proper, what should I say, feeding should be done. If you just put it hepatozoonosis, you may get information of Hepatozoon canis as well as Hepatozoon americana, right? And these two are different infections. Their pathophysiology is different. Hepatozoon americanum is responsible for musculoskeletal disease, doesn't occur in India, while Hepatozoon canis is restricted to visceral organs. So pathophysiology is altogether different. So while retrieving any information, or if you want to have any information, and if you are surfing on internet, you should feed it with the proper words. You should feed it as Hepatozoon canis, and then you will get the information of the species that is occurring in India. Then Ehrlichia, we have Ehrlichia canis. Then Anaplasma platis of late in last 10 or 15 years, these organisms have been reported quite widely from different parts of India. In babesiosis or pyroplasmosis, we have 2 species. One is Babesia vogeli. Now, this species was previously known as Babesia canis. The old Babesia canis is now distributed or split into 3 now: Babesia rosei, Babesia canis, and Babesia vogeli. And among these 3, the least pathogenic is the one which is occurring in India, and that is Babesia vogeli, which is a large pyroplasm. While Babesia gibsoni, as you all are confronted with these infections more frequently nowadays, more than Babesia vogeli, you are confronted with Babesia gibsoni, which is a small pyroplasm, very difficult to locate in the blood smear. So, see, the RBC size is around, see, if you look at the diameter, it is around 8 microns. So, if the organisms are of the same length as a radius or larger than the radius of RBCs, you can take it that it is Babesia vogeli or a large pyroplasm. And if the organisms are smaller than the radius of the RBC or the erythrocyte, you can take it as a small pyroplasm. Then you also have mycoplasmosis, that is Mycoplasma hemocanis. The old name for this is Hemobartonella canis. Now, taxonomy has undergone a sea change, and you will see different names have been proposed. And that is why you should be aware about the old names as well as the new names. So these are the canine vector-borne diseases reported from India. What I mean reported means reported in the scientific journals or scientific publications. I don't mean that they are reported from a pathology lab. Okay, so only published reports have been taken here for the deliberation. So all these infections have been reported from different parts of India. Now, the topic of today is epidemiology, because when the infections are widely prevalent, then clinical diagnosis is a problem. Epidemiology plays very important role, and one must know the epidemiology of the infection, so that it is the information is very handy to handle these infections. So what we did, way back in 2011 and 12, we did a comprehensive survey of Indian literature to find out the epidemiology, or to rather construct a epidemiological picture of canine vector-borne diseases in India. And then at the end of this exhaustive literature search, we did not get much of information which can be used for construction of epidemiological pictures. There were certain drawbacks or certain disadvantages, certain errors were committed by those researchers, and that is why we could not do it. So we published an article in an international journal with the title that Canine Vector-Borne Diseases in India, a review of literature and identifying the existing knowledge gaps. So when we did it, these are basically, as you can see in the blue boxes, these are basically the problem areas where, that is why we could not construct the epidemiological picture. So most of the references, they are available in the form of a case reports. So on the basis of single case or two cases, and then whatever symptoms that have been expressed by the dog or a cat, and whatever the clinical pathology changes were reported for that particular case, have been associated with the particular case, without giving a proper justification as to why a particular symptom was there or why particular pathological change was there. So that did not reveal much of information. Then majority of the surveys were biased surveys. What I mean that these surveys were carried out in different colleges or educational institutes, and whatever cases that were presented to the polyclinics of these institutes, so those cases were taken for conducting the surveys. So basically, you will see articles like prevalence of canine vector-borne diseases in pyrexia cases. Now, let me tell you at this point of time that some of the canine vector-borne disease cases are subclinical. There is no pyrexia. So you may not get a correct information. Then majority of the surveys were based on insensitive diagnostic technique. As you all know, blood smear examination is not a very sensitive tool for diagnosis of certain infections like Babesia, Gibsoni, or Ehrlichia canis. So that does not reveal a correct picture. Then there were sampling errors also in that, in the sense the sample should represent the different epidemiological groups that are existing in the population. So that was not there. And because of that, we could not construct an epidemiological picture of different canine vector-borne diseases for different zones in India. See, what I feel, when you are trying to construct an epidemiological picture, it is like arranging a jigsaw puzzle. In jigsaw puzzle, we have seen those pieces, we arrange it properly to create a picture. So epidemiological picture can also be constructed in the similar manner by collecting the pieces of information available in the literature and put it in a right perspective, so that the epidemiological picture can be constructed. But I'm very sorry to say the information was not based on a very scientifically conducted research, and that is why we could not construct the epidemiological pictures. Now, here I want to appeal all the pet practitioners. I know you guys are doing fantastic job in your clinics. A lot of information takes birth within the four walls of your clinic. But when you don't publish it, when you don't make it public, then that information dies within the four walls of your clinic. So I request to all my, veterinarians, pet practitioners, that publish it. I don't say you publish single case or two cases. Make a compilation of say 10 or 12 cases, or for a period of 1 year, and then publish it. It will be a great contribution to the knowledge of science, and then probably it will be great contribution to construct the epidemiological picture also. So, after going through the literature and when we found that there are so many, errors, and that is why the epidemiological pictures could not be constructed, then we conducted a broad-based survey and we tried to eliminate all those errors in this particular survey, during which we collected around 525 blood samples from apparently healthy dogs. Okay, so those dogs were apparently healthy. Those were not clinical cases. Okay, and we chose four different centers, each reflecting different agroclimatic zone. We collected samples from Mumbai region, which is a hot and humid climate, typical coastal climate. Then from Delhi, where the climate is dry, arid zone. Then from Leh Ladakh, like a mountain area. Then in Sikkim, which is a subtropical or kind of temperate zone. And these blood samples were collected, and we collected from all types of epidemiological groups of different age groups: males, females, intact male, intact females, neutered male, neutered females, stray animals, pet animals, animals with ticks, animals without ticks. So all those epidemiological groups were covered here, and in that proportion, the number of dogs, the proportion of stray to pet, the proportion of male to female. So that is also we tried to maintain in this particular sample. And these samples were then tested by a conventional method, that is a blood smear examination, as well as a Buffy coat examination, and also by PCR method. Now, whatever results, what we got, positive results, we did not just relied on that blindly. We did a further investigation. We did sequencing of all those PCR products to ensure that these are true positive, or to rule out the false positivity. There is a myth, some of the pet practitioners believe that once it is positive by molecular technique, there is no scope for doubt. No, it is not that way. There is a possibility of false positivity, and that is why one should, if you are not happy with the result, then you can ask for sequencing and reconfirm it. So that we did it for all positive samples, okay, and only those which gave true positive were included here. Now you can see here that you can concentrate on Mumbai and Delhi region, where the prevalence rate in Delhi was 77%. So 3 out of 4 cases, or dogs, not cases, dogs were positive for CVBD. In Mumbai, 60% was the prevalence, and that too in apparently healthy dogs. And the most common parasite was Hepatozoon canis, followed by Ehrlichia canis, Mycoplasma hemocanis, that is Hemobartonella, Anaplasma platis, Babesia vogeli, Babesia gibsoni. So if you look at the prevalence in Delhi and Mumbai, that will reflect the, say, 80% area of India. You will find Hepatozoon canis, Ehrlichia canis, Mycoplasma hemocanis, and Anaplasma platis. The prevalence is in double digit. So when the prevalence is in the double digit, you can say these infections are endemic in these areas. So you can say on the basis of this, they are endemic in all over India, except those mountain area or temperate zones. And one more, striking feature of this work, you will see that multiple infection or a mixed infections were also common to the tune of 45%. So every alternative case or a dog was positive for multiple infections involving 2 types of organisms, 3 types of organisms, or even 4 different types of organisms. And which is but natural, because the vector that is involved in the transmission of these infection is same, that is Rhipicephalus sanguinus. So logically you can say that the multiple infections are also very common. So the take home message here from this particular table, that we are endemic in CVBD, particularly Hepatozoon canis, Ehrlichia canis, Anaplasma, and mycoplasmosis. Then, when you get a report of only one type of organism, don't rely, what I mean to say, don't end there your investigation. Think of, multiple infection or a mixed infection, and try to find out, whether the dog is infected with any other additional canine vector-borne diseases or the organisms. So that one should always bear in mind. And then I think on the next plate, you will see the different combinations, that mixed infection with two different types of organisms. You will see in red, there are three different types of organisms. And in the last row, you will find the combination of Hepatozoon canis, Ehrlichia canis, Anaplasma platis, and Mycoplasma hemocanis, and in Mumbai as well as in Delhi. So mixed infections are every alternate case is a mixed infection case, and when there is a mixed infection, it also it dodges you clinically. That typical symptoms may not be expressed by the dog. When the pathophysiology is altered by two or three different types of organisms, you may not get a classical symptoms. So that is the status as far as the epidemiology is concerned. What we did, we did a very methodical analysis of the data, statistical analysis of data, on the basis of which, we found that, which is quite obvious also, that the chances of canine vector-borne diseases are more in the dogs having lower PCV value, but natural. Then the chances are 3.3 times more in dogs having ticks on the body than dogs devoid of ticks. The chances are 2.3 times more in stray animals as compared to pet animals. Understood. But now, one more very important finding which I would like to share with you all here, and that is the prevalence is more in intact animals as compared to neuter animal. And this again a take home message here, because relapses are quite common. So if you want to handle it, if the treatment is not giving results or there are frequent relapses, one can think of neutering the animal. Maybe hormonal uh, imbalance is stressful for the animal, and that is why there are more number of relapses. So neutering is one technique which can be followed if there are number of relapses, or the treatment is not giving desired effect. Now, if you look at these different types of canine vector-borne diseases, the list is there in the first column: Ehrlichia canis, Hepatozoon canis, Babesia vogeli, Babesia gibsoni. These are all tick-borne infection and transmitted by only one culprit is there, and that is Rhipicephalus sanguinus, which is occurring all over India. Now, in this, as far as Ehrlichia canis is concerned and Babesia vogeli, there is a trans-ovarian transmission. That means, the infection is transmitted through the eggs of the ticks, and the larval and nymphal stages of the next generation transmit the infection, which is very dangerous. And then for Babesia vogeli, it is transstadial. That means one stage picks up the infection and the next stage transmits it. Hepatozoon canis is acquired only through ingestion of the ticks, that is by consuming the ticks. Okay, so that is also a mode of transmission in case of Hepatozoon canis. And in our study, as you all know, we found the maximum prevalence of Hepatozoon canis. I have seen, that many pet owners, they take out the ticks from the body. They are just sitting in the living room watching TV, cricket match, or any daily soap, and they keep on picking up the adult, those big fat ticks, female ticks, and squash it on the floor. I have seen the dogs are licking it. That is how the transmission takes place. Some of the pet owners have a weird idea in their mind that the dog is getting its blood back by allowing such activity. So that is how the disease is transmitted, by consuming the ticks. Many times, there is an irritation on the body, so the dog just turn around and try to bite that particular area, and in the process the ticks are swallowed. Trypanosoma evans, as you know, it is a fly-borne infection. Tabanus stomoxis species of flies are involved in the transmission, and it is a mechanical transmission. In the sense, there is neither development nor multiplication of the organisms in the body of the flies. In fact, you will be surprised to know that these organisms survive in the mouth parts of these flies hardly for 15 to 20 minutes or at the most half an hour. So if the transmission has to occur, it has to occur in that 15 to 20 minutes. So they have got a interrupted feeding pattern, and that is how they go on biting several animals at a time, and that is how the disease is transmitted. The disease is also transmitted in trypanosoma by consuming the viscera of infected animals, particularly in rural areas. If there is a death of a large animal, the carcass is just dragged and left at the border of the village, and then the dogs have free access and they consume the viscera, and that is also the mode of infection. Okay. In cities, like consuming rodents are also source of trypanosoma infection. So particularly the dogs residing in bungalows, they have a habit of chasing these rodents, and they kill them and they eat them. So that is also the source of infection for these dogs. Mycoplasma henocanus is transmitted by different types of flies and ticks. So this is, just for your information, how transmission takes place. And once they are transmitted, in case of Ehrlichia canis, they multiply in the reticuloendothelial cells, that is, and in the granulocytes. And as I've said, there is also vertical transmission in the host. So the infected bitch can transmit it transplacentally or through uterus to the litter of pups. So vertical transmission is there. Hepatosome canis, initially there is a multiplication in the reticuloendothelial cells, and then gametocytes occur in the WBCs, circulating WBCs. That is a source of infection for ticks. Babesia vogel and gibsoni are transmitted, or they multiply asexually in the RBCs. In Babesia gibsoni, again, there is a vertical transmission in the host, like Ehrlichia. Okay, so Ehrlichia canis and Babesia gibsoni, vertical transmission in the vector as well as vertical transmission in the host or in the dogs. And Babesia gibsoni is also transmitted mechanically, through dog fights, or even, when the dogs are playing with each other, they have a habit of, locking jaw with each other. Occasionally, there is a bleeding from the gums, and that is sufficient for the transmission of infection. And probably that is why nowadays, you find, quite a few cases of Babesia gibsoni are there. Because, nowadays in cities or in metros, the dogs are, there are different facilities available for socializing the dogs. Like, dog parks are there, then dog restaurants are there. There are certain places where, those people can come and pat the dogs. So the dogs are mingled with each other. And while playing, while fighting, the disease can be transmitted. So that is how, the infection is transmitted. A little bit of theoretical part for you, and how the transmission takes place and what happens exactly, how they multiply, where they multiply. That is the information for you. Now, let us come to the clinical picture. So I have given you the epidemiological insights, and the clinical entity is also included in the epidemiology. Now, if you set a radar for the detection of canine vector-borne diseases, then probably what you will find, what are the presenting signs, what are the primary complaints of the pet owners, is basically the dog is lethargic or depressed, not responding to external stimuli. If there's a doorbell, the dog is not giving response. Or if there are birds chirping outside the window, the dogs are not responding. Normal circumstances, the dog is very inquisitive animal, will respond to all those external stimuli. But here, there's lethargy, depression. Then the dogs do not eat well. There is anorexia. They don't take interest in the food. A lot of food is wasted or left behind in the bowl. Then there is a pyrexia or a fever. The owner will also say that the inner portion of the ear pinna is little warm, or the nostrils are dry. There is also swelling of the paws or the dependent portions of the body. In addition to that, sometimes you will also come across the nervous signs, or the eye lesions are also there, joint pains are also there. So these are some of the additional signs. So when you take the dog on the table and do physical examination, in addition to these presenting signs, you will come across, in many cases, splenomegaly, enlargement of spleen, enlargement of lymph nodes, enlargement of liver. And if you just look at the gums, you will find the gums are pale because there is a hemolytic anemia. Or if it is a long-standing case, you may see icteric signs, yellowish tinge. There may be petechial hemorrhages. Occasionally, there may be ecchymotic hemorrhages. So all these additional symptoms can be seen once you examine the dog on the table. Now, when you come across this set of symptoms, even a beginner, even an internee will tell that this is a case of canine vector-borne disease, or CVBD, because the symptoms are classical, suggestive of a canine vector-borne diseases. But at the same time, even an expert or a very senior pet practitioner will not be in a position to identify which particular organism or organisms are involved in the particular case. So that is a typical clinical picture. And that is why I said, it is very sometimes difficult to do a clinical diagnosis. So these are the presenting signs, and then you examine. But again, there are certain clues, right? Now, all these signs are there, but certain signs they occur more frequently in certain diseases. The magnitude is more in certain diseases, and their duration is also more in certain diseases. So on that basis, I have created a suspicion index here, where, if you find certain symptoms which are more frequently seen, the magnitude is more, duration is more, then the needle of suspicion is tilted towards one or two different types of organisms. This is based on our research at Bombay Veterinary College, carried out in 2016, 17, and 18. If you see the phases of bleeding, there is a bleeding from the natural orifices, then you can think of canine monocytic ehrlichiosis, or canine tropical pancytopenia. If there is lymphadenopathy, swelling of lymph node, and eye lesions are there, then there are two possibilities, that is trypanosomosis and ehrlichiosis. If there is a hemoglobinuria, if there is a hypotensive shock, I will let you know what happens. Or hypothermia, the temperature, rectal temperature is below normal, you can think of Babesia gibsoni infection. Because generally what happens in long-standing cases in Babesia gibsoni, there is intravascular coagulopathy. And as a result of which there is a hypovolemic shock. So the volume is not normal. The extremities are cold. And that is why there is a subnormal temperature, hypothermia. So you can think of Babesia gibsoni here. If there are nervous signs, then think of trypanosoma. Very common. In our study, almost 25 to 30% cases showed nervous signs. So if there are nervous signs, then you can think of trypanosomosis, and also there is a possibility of pyroplasmosis with Babesia gibsoni, because there is a possibility of cerebral babesiosis in certain number of cases or in certain cases. So that is also a possibility. If there is a edematous swelling of the jaw, and there is a swelling of the lymph node of the head and neck, okay, and there's a change of voice, then you can think of trypanosomosis here. Then if you find, there are no classical symptoms, but there is a prolonged lethargy and depression, you can think of hepatosine canis. And as far as mycoplasmosis is concerned, these are complicating organisms. So by stretch of no imagination, I would like to rule out other possibilities. But when you come across these symptoms, the suspicion the needle of suspension is tilted towards one or two, and that has been well documented in our literature also, or in our whatever work we are carried out at Bombay Veterinary College. So you can have few clues for clinical diagnosis of these cases. Okay, as I've said, you can't rule out other things completely, but the possibility of these infections in these clinical signs are more. Then obviously, when you are not in a position to pinpoint one particular organism or whether it is a mixed infection, the normal tendency of the pet practitioner is to collect the blood samples and then investigate in the laboratory. So you will find in the laboratory there is anemia, and it is regenerative type of anemia. That means regenerative means you will find reticulocyte index is higher. Okay, normal percentage of reticulocyte, those are the immature RBCs, is around 0 to 2.5. But when you, in such cases, you will find that the reticulocyte percentage is more, maybe 5%, maybe 10%. So that is suggestive of a regenerative response in the bone marrow. So mostly these cases are regenerative anemia. So obviously you will find the anemia is normocytic and normochromic. Okay, so all those hematocrit indices, that is MCV, MCHC, MHC, they are well within the normal range. That is the meaning of normochromic, normocytic. And then you will also find thrombocytopenia. Now, there is a tendency of the clinician that when they come across thrombocytopenia, they equate it with ehrlichiosis. That should not be done, because thrombocytopenia, we have established this in our research also at Bombay Veterinary College, that thrombocytopenia is also seen in other canine vector-borne diseases. Okay, so thrombocytopenia, no doubt, it is an important clue for canine ehrlichiosis, but the other things should not be ruled out. Or what I mean here, that you should not equate it with Ehrlichia canis. As far as the biochemical profiles are concerned, you will see high serum creatinine, high blood urea nitrogen. Again, develop the habit of finding out the ratio of serum creatinine to blood urea nitrogen. When you find the ratio, you are in a position to identify whether the cause is a renal cause or a pre-renal cause. The normal ratio is 1:15. But when this ratio, goes down, that means if the ratio is less than 15, maybe 10, maybe 9, then you can consider that it is a renal cause or the kidneys are affected. If it is more than 15 towards 20 and 25, you will find there is a possibility of pre-renal cause. Okay, so that is the significance of doing this particular exercise. Then in long-standing cases, all these changes, let me tell you, are seen basically in chronic cases or long-standing. In acute phase, all these changes you may not see. Okay, but as you know that these cases are difficult to treat, relapses are quite common. So mostly, say 7 or 8 cases out of 10, you will see the relapses or long-standing cases. Then there is a reversing of albumin and globulin ratio. Liver is affected, so albumin is the liver is a principal site for synthesis of albumin. So albumin globulin ratio is affected. Globulins are more because of a chronic infections, high level of SGOT and SGPT. These are the changes. Again, all these changes are suggestive of canine vector-borne diseases, but does not definitely pinpoint, about towards one particular organism that is involved in the infection. Now, as I've said, there is a thrombocytopenia. Why there is a thrombocytopenia? There are different reasons for thrombocytopenia in different infections. For example, in trypanosoma, in our study at Bombay Veterinary College, we found that 70 to 80% cases revealed thrombocytopenia. Okay, so we do not know the exact reason, or in the literature, there is no sufficient information available as to why there is thrombocytopenia in trypanosomosis. In canine monocytic ehrlichiosis and in pyroplasmosis or in babesiosis, thrombocytopenia is due to antiplatelet antibodies. In long-standing cases, there are anti-platelet antibodies are formed, and those antibodies are responsible for destruction of thrombocytes, and that is the reason of thrombocytopenia. Then one more reason is, particularly in Babesia gibsoni, as I've said, there is intravascular coagulopathy. So obviously thrombocytes are consumed during those coagulopathies, and there is a thrombocytopenia. Then there is also, injury to the endothelium, that is the wall of the vessels. And then to heal such injuries, there is thrombocytes are required. So thrombocytes are consumed in large numbers, and that could be the reason of thrombocytopenia, again in ehrlichiosis and babesiosis. Then liver and kidney damage is also reason. As you all know, that thrombopoietin is a precursor which is synthesized in the liver and kidneys. So when that is in short supply, obviously less number of, or there is a reduced synthesis of thrombocyte, and that is the reason for thrombocytopenia. So there are different reasons in different infections for thrombocytopenia. One take-home message at this point of time, because next Saturday I have got one more lecture on the same topic where we are going to discuss in more detail. But at this particular point of time, you can take it that don't equate thrombocytopenia. I know for sure thrombocytopenia is an important sign. The magnitude is more in ehrlichiosis, yes. Then see, when thrombocytopenia is less than 50,000, you can think of ehrlichiosis. But if thrombocytopenia is say 80,000, 90,000, or 110,000, not necessarily it is Ehrlichia. It could be trypanosoma, it could be Babesia, it could be even hepatozoon canis. Okay, so severity of thrombocytopenia should be the benchmark. Then why there is hemolytic anemia? The old school of thought is that, because of the organisms which are multiplying in the cells and they cause destruction of the cell. But that has been now sidetracked. That is not the reason. It is a typical hemolytic anemia, and there are a number of reasons involved in this. And all these reasons are common in all these infections. These organisms, when they are multiplying, certain biochemicals are produced, and those biochemicals are responsible for the damage to the cell membrane, RBCs or erythrocytes. Then there is also oxidative stress. So there is an oxidative injury to RBCs. Okay. And as a result of these two factors, the osmotic fragility of the RBCs is increased. And such RBCs are then vulnerable for sequestration in the spleen. So there is a erythrophagocytosis. So in general, when the cell membrane is damaged, when there is oxidative stress, the lifespan of the RBC is reduced, shortened lifespan, and that is the reason of anemia and normocytic normochromic anemia. One more reason, which is now well documented in the literature and it is well accepted also, that it is basically immune mediated. That means the antigens of these different organisms, they are coated on the surface of RBCs. They are adsorbed, not absorbed, adsorbed on the surface of RBCs. And such RBCs are then taken by the immune system of the body as a foreign material. And then those RBCs are phagocytized or destroyed. Okay, so that is immune mediated. That could be the reason, even in thrombocytopenia and trypanosomosis. Now, trypanosomes are not intracellular; they are free in plasma. So, they ideally they shouldn't cause anemia, but in trypanosome also anemia is there because of the coating of antigens of trypanosomes on the surface of RBCs, and then they are vulnerable for destruction. Okay, so when there is an immune-mediated anemia, then if you do Coombs test, direct or indirect Coombs test, you will see positive reaction because these the network is formed. They don't form a button, right? Because the antibodies are there, so these antibodies keep them separated. So you will see, as you can see in the picture, just take a blood drop on the glass slide and put a normal saline on it, just mix it well, and you will find a meshwork, as you can see in the picture. So that is in the Coombs positive, and that could be because of the immune mediated anemia or the antibodies present against those RBCs or those antigens. So In these cases, there is a hemolysis. There are two prominent features in long-standing cases. One is a hemolysis. Now, it could be extravascular or intravascular. In most of the hemopoietic system, CVBD, it is both, intravascular as well as extravascular. So what happens? We have seen why there is hemolytic anemia, okay, in long-standing cases. So as a result of this, ultimately, if it leads to, hemolytic crisis or hemolytic severity increases, and in such cases, you will find there is hypoxia, there is a paler, the mucous membranes are pale, conjunctiva is pale, icteric, then there is a exercise intolerance, general malaise, the condition goes down, syncope and death. Syncope is unconsciousness and death. So that is the hemolytic crisis in long-standing cases. You need to differentiate it from toxin-induced hemolytic crisis. Inherited RBC fragmentations are there in certain conditions, and also in certain viral infections. This kind of effect can be seen. So that is in long-standing cases. And second is, particularly in babesiosis and to some extent in ehrlichiosis, there is a generalized inflammatory reaction. Particularly, it has been well documented in the literature about pyroplasmosis that in long-standing cases of pyroplasmosis, certain cytokines are released at a high proportion. And these cytokines, I can quote one example, that is a tumor necrotic factor. Okay, so tumor necrosis factor is a cytokine, and it has been now well established that the concentration of this TNF is directly proportional to the symptoms of babesiosis. So, what happens during this when the TNF increases? There are certain harmful substances that are released. Those are like nitric oxide, they are converted to nitrate and nitrite, and also free radicals of oxygen. Now, when these harmful substances are released, they mediate a reaction between the infected RBCs and the vessel wall. And as a result of which, there is a vesiculitis or vasculitis, the inflammation of the vessels. And there is a generalized inflammatory reaction. And that is at the terminal stages, we say that multiple organ failure or multiple organ dysfunction is there. So these are the two prominent features of the long-standing cases of canine vector-borne disease, particularly in babesiosis and ehrlichiosis. Now, like symptoms, there are certain clinical pathology changes which are suggestive of certain infection because they are frequented more, their magnitude is more, and their duration is also more. So let us see that if there is a aplastic anemia, as you all know, in terminal cases of canine ehrlichiosis, there is aplastic anemia. So when there is in most of the other cases, as I've said, there is a regenerative anemia, normochromic normocytic. But here, when you see hypochromic microcytic aplastic anemia, it could be a terminal stage or a chronic stage of ehrlichiosis. When there is a azotemia, okay, so proteins in the urine, that is mainly due to glomerulonephritis, and it leads to, in long-standing cases, protein losing nephropathy, and this is seen in ehrlichiosis. This is seen in Babesia gibsoni. Very commonly it is seen. Okay. You will also, Babesia gibsoni, you will see, the nephropathy is pre-renal. That means the ratio of serum creatinine to blood urea nitrogen is more than 50. When it is a renal cause, then it should be less than 50. So you will find in Babesia gibsoni, it is pre-renal, while in other infections like trypanosoma and ehrlichiosis, you will find it is a renal cause. Increase in liver enzymes, what we found in our studies at Bombay Veterinary College, that it is mainly hepatogenosis. I faintly recollect we have seen around 25 cases of hepatozone canis, pure infection, no other concurrent CVBD, and we found almost 23 to 24 cases had a very high levels of liver enzyme, SGOT and SGPT. So that one can suspect. If there are coagulopathies, of course, how would you know coagulopathy? By prothrombin time estimation, and you will see that is in Babesia gibsoni infection. Hypoglycemia is a feature of trypanosomosis. So when you find the blood glucose is less than 120, less than 100, we have seen it is going down up to 50 and 60, 40s, then that could be a case of trypanosoma infection. Again, by no stretch of imagination, I'm saying that I am ruling out the other possibilities. But when these changes are seen, these observations are encountered, the needle of suspension is tilted towards these infections. So I think this is for the day. That is a clinical epidemiology of CVBD. In the next lecture on the next Saturday, we are going to discuss about the diagnosis, confirmative diagnosis, specific diagnosis, treatment options, which is again a very interesting topic. So the take-home message for the time being is that CVBD, as you all are confronted, it is more common than reported. Even the apparently healthy animals are positive. Then the urban areas where the dog population is more, the diseases like hepatozoonosis, ehrlichiosis, anaplasmosis, and mycoplasmosis are endemic. Co-infections are quite common. We have seen that almost every alternate case is a co-infection involving 2, 3, or 4 different types of organisms. Now, symptoms and laboratory findings are not consistent, okay, or may not be pathognomonic because these symptoms are masking, overlapping. And in mixed infection, again, it is very difficult. Uh, Thrombocytopenia and hemolytic anemia are the two important findings of the blood analysis. And my take-home message, don't go blindly that when you come across thrombocytopenia, it is a case of ehrlichiosis. Think of other CVBDs also, okay? And in long-standing cases, may lead to hemolytic crisis. Sometimes, like for example, Babesia gibsoni, you don't have a foolproof treatment. So, the relapses are quite common. So the pet owners should be taken into confidence and the scenario should be explained to the pet owner that, this is the issue, why there is a hemolytic anemia, why the mucous membranes are pale. Even after giving hematinics or the supportive therapy, this anemia doesn't improve much. Okay, so that is there. So generalized inflammatory response is there in long-standing cases. I think with that, I will end my talk. And if there are any questions, I'll be happy to answer those questions. Thank you. Thank you very much, ladies and gentlemen.
Thank you, sir. Thank you very much. So, meanwhile, I would like to request the participants that they can type their questions in the chat box, and Dr. Samir will read out the questions, and the reply will request Dr. Gatne sir to get the most possible replies by today only in this session only. Meanwhile, you all are typing the questions. We we would like to give some just a presentation for 5 minutes regarding our one product. So, Dr. Samir, you can compile the questions and participants can write down the questions in the chat box.
So they can write on the chat box, or if possible, they can just raise the hand. Then we will unmute them.
Noted. Okay. So, meanwhile, you will write. So, we would like from Alembic Pharmaceuticals Ltd, we would like to present our recently launched new product that is called as Lannerwin. So, this Lannerwin product is, it's about the beat the infection of ticks and fleas and all the ectoparasites. So, we have also come up with the brand called as Lannerwin, containing the most advanced salt called as Fluralanner. So to win the battle against the ticks and fleas, one tablet is sufficient for 90 days. We have the product called as Lannerwin, containing the salt Fluralanner, and this is in chewable form. So here are the some glimpses about the product. So what exactly is Fluralanner? It is nothing but the ectoparasiticide belonging to the group isoxazoline. It's a benzimide compound. This inhibits the nervous system of the ticks, causing paralysis and death. So Lannerwin is absorbed into the animal's bloodstream after oral administration making it effective against fleas and ticks that feeds on the treated animal. So once you suggest this, once the your pet is taking this, so the salt will remain into the bloodstream, and when the ticks or ectoparasites they are taking it, it will go into the body, and then it will have a specific target specific where GABA gated, glutamated gated chloride channels in the nervous system of the insects and acarids. Acarines, it will affect there. So here is the mechanism of action. The receptors are crucial for nervous signal transmission. Lanarvin blocks these receptors, disrupting the normal functioning of the nervous system. So by blocking these channels, Lanarvin causes the overstimulation of the nervous system, leading to convulsions, paralysis, and ultimately death of the parasites. So this is what is mode of action of the Lanarvin. If we talk about the effectiveness and safety margin, so Lanarvin is highly effective against fleas, ticks, providing rapid and sustained protection. Safety is Lanarvin is generally considered safe for the animal when used in the as suggested direction. So when we go for the Lanarvin or Flurananor, there are some frequently asked questions by the veterinarians. Is it safe for the puppies? Yes, Lanarvin can be given to the puppies with specific age limitation. You have the we have Flurananor 250 mg chiefs that are designed for the puppies 8 weeks of the age and older, weighing 2 kg or more than that. So there is another queries from the some questions are there frequently asked question from the pet practitioners. Is it safe in pregnancy? So yes, Lanarvin is generally considered as safe for the pregnant dogs, pregnant bitches. It has been evaluated for the use in breeding, pregnant and lactating dogs, and it is this is approved for use in these stages. Now, is there any side effect to the host when it is where it no it is retained in the body for 90 days? So the reply for this is the active ingredient of Lanarvin is generally well tolerated in dogs. There is no no very highly complicated side effects are there. Rarely having some limited self-limiting and short duration, like some short duration side effects may be there, but that will not be for the long time. That will not cause any very crucial problem to the pets. So these are some frequently asked questions regarding the Lanarvin. So thank you very much. So here we are presenting the product Lanarvin. It is available in all three packings, that is 250 mg, 500 mg, and 1000 mg. And there is 250 mg is for more than 4.5 kg to 10 kg. And from 10 kg, more than 10 kg up to 20 kg is 500 mg. And more than 20 kg up to 40 kg is 1000 mg. One time chewable tablet can be recommended. So this is what about Lanarvin. So win the battle against the ectoparasites by using Lanarvin. Thank you. Thank you very much. So Dr. Samir, are there any questions?
Yeah, there are some questions. Okay, some questions have been wrote in the chat section, so we'll try to answer those questions. Okay.
Okay.
Dr. Rajesh Dubey, line of treatment of hepatitis.
Line of Dr. Rajesh Dubey.
Line of treatment for hepatozoonosis. Actually, my next lecture is on diagnosis and treatment. I think, so please reserve this particular question for the next session, because, it's like opening of a Pandora's box. If I start, explaining, then there'll be questions and counter questions. So I would like to reserve this for the next session. Then again, treatment for Babesia, all treatment aspects, yes, I will explain with their, advantages and disadvantages and what should be done in case of relapse cases. I will do that in the next session, because it is a big topic and we need a more time. Sir, can you please explain what is it?
what will be the effect of TLC count on CVBD by
Sir,
Amol Gautam?
explain what will be the effect of
TLC.
TLC, total leukocytic count. See, in total leukocytic count, there is nothing conclusive which can be said here, because we have done research on canine trypanosomosis, canine ehrlichiosis, hepatozoonosis, and pyroplasmosis. And the hematological investigation in all these cases showed a varied responses. So you can see from leukocytopenia to leukocytosis. In differential diagnosis also, you will see neutrophilia, neutropenia, lymphocytosis. So different trends are seen, eosinophilia. So that is not conclusive. On the basis of TLC, one cannot distinguish the canine vector-borne diseases, and the differential diagnosis is also very difficult. Okay. So TLC has a very limited this thing. Only what you can say that there is a inflammatory process that is going on in the body. Then thrombocytopenia is a necessary finding for CVBDs? No. Thrombocytopenia, see, for example, I have said in case of ehrlichiosis and in case of babesiosis, there is antiplatelet antibodies. Now you can imagine here, in order to form antiplatelet antibodies, it would take around maybe 3 to 4 weeks or even more than that. So if you examine before that, those antibodies are not there. So there may not be thrombocytopenia, right? Sometimes, in prolonged cases, you see thrombocytopenia, or in very acute cases, you see thrombocytopenia. So I don't say that every Ehrlichia case, because we have done research on Ehrlichiosis also. So all the cases may not reveal thrombocytopenia. See, in my clinical experience, I used to give more, weightage for thrombocytopenia if thrombocyte count goes below 1 lakh, and I used to consider as a life-threatening when it goes below 50,000. Right? When those, hemorrhagic spots develop, the thrombocyte count is usually less than 50,000. Sir, does really triple therapy? That is again reserve it for next session, please.
Nervous, sir, seizures in ehrlichiosis dogs. Have you seen, like,
do we find nervous signs seizures in ehrlichiosis in dogs? How do we manage it? Now, the nervous signs you will see, if in dogs, the most common cause of nervous signs is Trypanosoma evans, followed by Babesia gibsoni, and there are very few references of Ehrlichia canis associated with nervous signs, because I don't know what happens, sometimes why there is nervous signs in canine vector-borne infection is basically there is a clumping of infected RBCs to each other and to the endothelium. And as you all know, in the brain, these capillaries are very, very small, so there they occlude the capillaries, and that is the reason for cerebral form of CVBD, which is seen in, not commonly, which is seen in Babesia gibsoni. In Trypanosoma evansi, there are number of, what should I say, postulates for nervous signs. Some people also say severe hypoglycemia could be the reason for nervous signs in that. Clinical differentiation between babesiosis and ehrlichiosis. Where is that?
MS Mano Sharma.
What is the prognosis of cerebral babesiosis? The prognosis is always guarded. Where is that question gone? Clinical differentiation between babesiosis and ehrlichiosis in field conditions. Now, in field conditions, as I've said, that ehrlichiosis in a terminal chronic phase or very acute phase, if you see bleeding from the natural orifices, the most likely reason is ehrlichiosis. Okay, when you see a dog is in aplastic anemia, where all types of cellular components have reduced, there is a thrombocytopenia, there is anemia, and there is also leukocytopenia. So that is why the disease is also known as tropical canine pancytopenia. But that happens only in terminal stages. As far as Babesia gibsoni is concerned, if you come across a case of hypothermia, hypovolemic shock, so you can think of a Babesia gibsoni infection. Otherwise, in say 70 to 80% of the clinical cases, one has to have clues from the laboratory. Okay. I have answered this. Can canine vector-borne diseases affect pregnancy and is vertical? Yeah, vertical transmission has been established now in case of ehrlichiosis and babesiosis. But as on today, even in the world literature, I haven't come across a reference where the pregnancy is terminated because of the canine vector-borne diseases. Okay, so I need to search on this. Maybe for next session I will come prepared for this particular questions. I will get next 4 5 days. I will just go through the literature and find out is there any information regarding this. What is a safe treatment part next time. Treatment part is will wait. What kind of mixed infection is more dangerous? See, individual infection is also dangerous, like Babesia gibsoni, where you can't treat it completely, Ehrlichia canis, where prolonged treatment is required, and in both these cases, independently also, there is a nephropathy. Okay, so protein losing nephropathy is there, so that is dangerous. But mixed infection, what we found across India, the most common was like hepatozoon canis with Ehrlichia canis. And nowadays, of course, the publications which I showed you are 10 years old, and because in that publication, you might have, noticed that Babesia gibsoni was not high. But nowadays, we get Babesia gibsoni very common. So maybe Babesia gibsoni, Ehrlichia canis, Mycoplasma, Anaplasma platis, and Hepatozoon canis. Because that is the meaning of endemicity, right? In urban areas, hepatozoonosis, ehrlichiosis, and anaplasmosis, they are endemic. So when endemic, mixed infections are there, and obviously when there are mixed infections, then that could lead to a very life-threatening situation. When is the next session? Thanks a lot. Okay. These Anaplasma platis and Phagocytopenia infections are threatening. Anaplasma platis is occurring in India. Anaplasma phagocytophilium is called as canine granulocytic ehrlichiosis, which doesn't occur in India, okay, because the vector is not here. So, of course, during that SNAP4, SNAP5 or IDEX text, I have seen some of the positive results, but that could be cross-reactivity because, it is antibody-based test. And what is this? Anaplasma platis. Yeah, Anaplasma platis, if not treated, fortunately, Anaplasma platis can be treated effectively with doxy. So that is not threatening as such. It is a cyclical thrombocytopenia. Sir, you mentioned hemoglobin urea is mostly associated with pyroglycosis, but hemoglobin urea is usually seen in early cases also. No, see, I haven't come across, maybe a mixed infection because hemoglobin urea, if you see the literature, it is basically associated, not all cases, maybe 10% cases, even less than that, are associated with Babesia. And with this now, Babesia gibsoni. Babesia vogeli is that way non-pathogenic. It is pathogenic only in dogs below 6 months of age. Okay. Otherwise, no. But ehrlichiosis, hemoglobin urea is not that common. Okay. Maybe, there is a bleeding. So there could be hematuria, right? there's a difference between hemoglobin urea and hematuria, right? So it could be a case of hematuria, not hemoglobin.